Welcome back, YouTubers, to my channel, A Very Day Life of an Aspie. If you landed to my page today, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness and sharing my life story with you with Aspergers Syndrome, OCD and the like, along with tips and advice along the way with mental health versus your general health. So, as I said before, I'm trying to tidy up some loose ends, even though yes, it's a broad topic for some of these health and awareness videos that I want to address with you all. And there was a couple of videos I wanted to share with you all for fun and games this week, but obviously for some reason I'm having problems trying to get that video up to scratch, so hopefully it will come to play soon, what I got up to with some people, hopefully later on. So this one's obviously going to be another mental health and awareness series video, which hopefully you're liking some of these, as well as hopefully some of the other videos as we progress on before the end of the year will be basically based on other things, be it genetic disorders and other health related topics. And hopefully in saying that, I'm hoping to do some Christmassy kind of vlogs that is autistic related or not, time depending obviously of what I want to share with you all. So, obviously, this one's going to be called the Antisocial Personality Disorder. If you're liking some of these mental health disorders and other health-related topics, give me the like button or just say, yes, SB, I am enjoying these, so that hopefully in saying this, we can actually get the ball rolling and actually follow through what you guys like and don't like, and whatever comes to play or surface, I'll deal with it. So if you go through any of these mental health disorders also, if you're willing enough and open enough to actually share life stories with these disorders that I clearly address to you all, feel free to comment them below so that we can actually get to know each other and you know, maybe learn from each other how we, you know, interact by how we go on in our everyday lives, regardless what it is. If not, I clearly understand, you know, it can be a bit daunting to try and share on the internet about our, you know, personal life, what goes through. But I'm here for an open discussion, or even just for people to just private message me, regardless. Also, just a heads up before I begin this, also as a disclaimer, as always, I'm no medical doctor. I'm just your normal Joe blogs that's sharing my life stories with Aspergers Syndrome and the like. So if you see any clinical warning signs and symptoms that has been in the past or present videos that you've been watching, do seek professional help for yourself or your loved one, or even seek an opinion for yourself or your loved one, because I don't forever condone self-harm. I want you guys to be happy and actually be able to be loved and know that you're not alone in this journey, whatever you're going through. So let's begin this. As you know, every once in a while, you know, everyone will feel a bit antisocial to a point. You know, when it comes down to certain social gatherings, some of us just want to, you know, back off the bus. It's like, not for me, what have you. Am I right here? Do you feel that way sometimes when when you feel that you have to push yourself regardless of it all, and then a terminal event comes up? Be it, as a classic example, a friend invited you to a party and they want you to enjoy yourself and have a bit of fun, and it's just like, don't know really. But people with antisocial personality disorder, or ASPD, I think it is abbreviated down to, forgive my clinical terms, these type people have a hard time obviously respecting or connecting with others. I'm not trying to put this as a judgment here, it's just what I've seen, as well as what has been clearly been researched by, you know, clinical experts. So you may be wondering what antisocial personality disorder is, right? Well, obviously, in terms of saying this, it's an psychiatric disorder in which a person manipulates, exploits, or violates the rights of others. And this behavior is often a kind of a criminal kind of behavior, and then it will also under the trait to come under as a psychopath. Signs and symptoms to look out for in this is a persuasive right and wrong for society norms. So they may know what's right and what's wrong, but they'll still push the boundaries to the point of no return and actually, you know, niggle the way in and whatnot. And then another one is, like I said, is, you know, manipulation. They'll manipulate the situation. People with this type of disorder may also engage in some criminal activity with frequent run-in with the law, no matter what it may be. It's not always the case, but some. A person with antisocial personality disorder often lies, steals, causes fight with others to the point of no return. Another fact here for people with this disorder is the rights and feelings of others or people will not often manifest to as lies or deceit, coupled with intimidation of others, violent and aggressive behaviours. Also, with people with this disorder won't show any signs of guilt or remorse of their own actions of whatever they have done. You know, but if they stole something, they won't show any guilt or remorse. It's like a blank face on them all over the place. So they're like a poker face here, so they won't smile, they won't show any kind of, you know, feeling or what have you. It's not surprising for someone, however, who has, you know, has this disorder will try to engage any social intimacy with another person. Obviously, they'll try and avoid it sometimes. But despite all this, they are good at showing artificial charm and flattering and manipulating others. The symptoms will tend to peak at the tender age of the late teens to early 20s, just a heads up. They may improve on their own by a person in their 40s. Sadly but surely, it just went out. The complications of this disorder is imprisonment, drug abuse, come hand in hand with some compulsive disorders such as, you know, drinking, you know, being on the booze maybe, or some chronic gambling. Additionally, they may also have some mood disorders or anxiety. The mood disorders I'm referring to is either, you know, bipolar maybe. They could go through a series of bout of depression. They could basically to the point of not just depression or that, they could go to the extremity of other things. So, diagnosing. The patient needs to at least be 18 years old or older for this, which is sad but true, and has those symptoms that I have clearly briefly shared with you and just now. In contacting of stealing or violence before that tender age of 15 years, because usually it tends to revolve around there, roughly. Even after diagnosing, it can be difficult to treat, you know, the patient or the person with this disorder, because obviously they don't care about causing pain and other problems to, you know, their partner here, so if they're in a relationship or just their family or friends. Treatments and therapies can be difficult to treat for this type of disorder. People with this disorder don't usually seek treatment on their own, however. They may only start therapy only when required, when others, you know, tend to, you know, spill it out, especially in the court of law after, you know, they've done something in the eyes of the law that was wrong. Effectiveness of treatment isn't known though, however. Accurate diagnosis from therapists, specialists usually use specific guidelines in the American Psychiatric Association Journal. But another form of treatment or therapy they may go under is psychotherapy or talk therapy. People that are willing to get the help that has this disorder will tend to do this regardless. And under treatments also, some people with this disorder may have some meds to help, sort of thing, for other disorders that comes in the territory of this disorder, be it depression, be it the mood disorders that are clearly addressed and whatnot. So this quickly ends a real short brief overview of an antisocial personality disorder. Give me a like for a thumbs up this video, comment below if you feel to, just to let me know maybe, or others know, if you want to share your story with this and how you go about it, and maybe we can learn from each other. I'm hoping that this channel will be a non-judgmental channel so that we can get to know each other regardless. Also, feel free to comment anything else that you feel that maybe comes into play with this, be it whatever it may be. You know, is there some compulsive disorders that you deal with on the daily, and how do you, you know, break free from them, and whatever it may be. Don't forget, while you're down on the bottom of the screen, if you're commenting and you haven't done so already and you want to be part of my YouTube family while journeying with me today, no pressure. If you want to subscribe to my channel, it's on the bottom right hand corner of the screen. While you're down there, also as a heads up, turn on the notification bell so you can get up to date with my new content regardless what it may be. Hopefully with some of this and saying this is educational for you enough and also entertaining enough. And also let me know with some of the videos that I may have presented if they have helped you. It would be nice to have some feedback here and there. It would be much appreciated. So in all to do, guys, basically follow me on my social media sites. Feel free to also just to share these videos around. And all for the do, guys, thanks for your support, thanks for watching, do what you love what you do. Until next time, Aspie signing out, and I'll see you around. Ciao.